Welcome back to NewsX World. I'm Megha Sharma and you're watching Focal Length, where we get you a briefing on topics from across the world. Amidst the ongoing crisis in Gaza, UNICEF has now warned that the children in the region are facing severe malnutrition as hospitals collapse and humanitarian access remains blocked. Distribution of aid is unsafe and uneven, and the global ceasefire calls lack logistical support. Immediate international action is urged to protect the children and mothers amid the escalating humanitarian crisis. To talk about this, joining us on the show is Rosalia Bollen, who's a UNICEF communications specialist and the spokesperson for Gaza, with an extensive experience in humanitarian response, child protection, and crisis communication across the conflict zones and emergency settings. Today, she discusses Gaza's humanitarian crisis, challenges in aid distribution, global ceasefire calls, and urgent action needed to protect children and mothers. Rosalia, thank you very much for joining me. And of course, I do want to understand from you that, you had spoken earlier. You said that in July that there is no safe place in Gaza. And from where you sit now, has anything materially changed in terms of civilian safety or predictable humanitarian access corridors?
Well, sadly and incredibly, things have only gotten worse over the past months, and that is because of intensifying military operations around Gaza City, where 1 million people are left, including half of them children. We've seen an escalation of airstrikes and also the issuance of displacement orders telling the civilian population to move south to the southern part of the Gaza Strip. But this population is a population that is exhausted, it's traumatized after nearly 2 years of war. Famine was just declared in Gaza City. And malnutrition rates have been soaring. So we're talking about a population that is extremely vulnerable. And we have a team up in Gaza City who is visiting hospitals, who's visiting families, and they've come across many vulnerable families. They've met a woman who had just given birth on the road as she was trying to move south. We've met children who got injured on September 1st in airstrikes, who lost their legs and who are in hospitals and who literally cannot move, who are in a very precarious situation. So civilian safety has deteriorated even further. We've been saying for 2 years now that there is no safe space in Gaza, and sadly today that still holds true.
Right. UNICEF also made a mention that there are tens of thousands of under fives, these toddlers that have been enrolled in acute malnutrition recovery since August. Are admissions still climbing up? These numbers, are they increasing exponentially? And which are the worst hits hotspots that you are observing?
Yeah, so UNICEF, currently we have 140 points across the Gaza Strip that are operational, where we screen children under 5 and pregnant and breastfeeding women for malnutrition. And we have seen a really important increase in acute malnutrition among children under 5. From February to July this year, there has been a more than 500% increase in the number of cases. There were around 13,000 children diagnosed as acutely malnourished in July, and the numbers we have for August are very similar. There are 12,800 children as well. So that trend continues. We see not just an increase in the number of children with acute malnutrition, but we also see that proportionally there are more children with the most severe case of acute malnutrition, the most serious form, which we call severe acute malnutrition. And these children are so weak. They can't stand up. They're often too weak to eat. They can't go to the bathroom, and often they're even too weak to cry.
That's deplorable, and clearly a humanitarian crisis that has escalated. Talking about the Prime Minister of Israel, his government has said that there is no famine in Gaza, that the images coming out of the strip are quote-unquote Hamas propaganda. How do you fight these comments that come from the highest positions in Israel, and to a certain extent the United States administration also endorsing that point of view?
Yeah, I mean, you've probably seen the images yourself coming out of Gaza. UNICEF, we've had a team of international and national staff on the ground in Gaza for the entire duration of the war. As I said, UNICEF is operating these nutrition support points, these outpatient treatment centers, and we are collecting the data ourselves firsthand. Whenever I go to Gaza, I don't need to look far, sadly, to find children who are acutely malnourished. As a matter of fact, the first time I entered the Gaza Strip in October last year, so that's nearly 1 year ago, the first child I met was an acutely malnourished child who had cancer, who was in a hospital in Deir al-Balah. So the images coming out of Gaza are images taken by humanitarians like myself. We have been documenting the situation, and it's just really appalling that the debate is shifted towards that when it's obvious that children are deeply suffering and that they are dying from hunger. And so the debate should really be about how can we save these children's lives.
Talking about Gaza's health system that has almost collapsed, there are only a fraction of hospitals and clinics that are partially functioning now. There are many that are lacking fuel, medicines, clean water. What is UNICEF witnessing on the ground inside these facilities, and what immediate steps do you think are needed to keep them operational for children and mothers?
I mean, these facilities, I don't know that we can still call them hospitals. I've been to hospitals in the northern part of the Gaza Strip and in the center and in the south. And they have lots of things in common. Often these hospitals have come under attack themselves, so the buildings tend to be heavily damaged. You have maybe one room with patients, and the adjacent room is heavily damaged with bullet impacts in the walls or walls that have collapsed. The hospitals are severely overcrowded. Rooms that are meant for maybe 3 or 4 patients, they can have up to 10 patients. There's lots of relatives of these patients who are also in the hospitals. And then there is this brutal shortage of medical supplies, medical equipment. When you go to neonatal intensive care units, you see incubators that are meant for one baby, but you see 4, 5, 6 babies stacked into a single incubator just because there's not enough space. So these hospitals, they operate barely and under very difficult conditions. The nurses and the doctors who are staffing these hospitals are absolutely selfless. They tend to stay in the hospitals 24/7. They tend to sleep there too. They just work around the clock, also because of the constant inflow of severely injured people. And I would say that the tragedy is not just that many children are being killed day in, day out. On average, an entire classroom of children is killed and injured in Gaza. But those children who are lucky enough to survive bombardments, they often have severe burns, they miss limbs, they have shrapnel lodged in their bodies, and when they arrive in the hospital can't care for them. They don't have the means to perform surgery on these children. If they do, we know that some surgeries are taking place without anesthesia just because of the lack of medicine.
Rosalia, now given the scale of suffering that you have described, what do you think is your most urgent message to the international community, and what practical action do you want to see tomorrow to change the reality for Gaza's children and mothers?
Yeah, UNICEF has been calling for a very long time now for an immediate and lasting ceasefire, so that the killing and the maiming of children stops, so that the hostages can be released. They can go back to their families too. They've been through incredible suffering, and so that aid, humanitarian aid, which is very much needed, can reach families in need. We've had a ceasefire in February this year. We know that it's possible, it's within reach, the solution is within reach. We now need the political will to make it happen.
Rosalia, Bollen, thank you very much for speaking to us on NewsX World. And even as the crisis continues unabated, efforts are being made by the United Nations, UNICEF particularly, to safeguard the lives of the children as best is possible for them in the current limited circumstances. Well, with that, it's a wrap on this episode of Focal Length. And for more international news and updates, stay tuned on NewsX World.